getting tweets as you're speaking, and one is just coming in. Public option, always the goal. Force rates up. We cannot afford it. I pay $11,000 a year with $15,000 deductible. Fewer doctors in Florida take Obamacare. What do you say to that? How come fewer and fewer doctors are even accepting Obamacare? I mean, look what happened with United Health. Look what happened with these insurance companies, Aetna. They are bowing out. They're losing $1 billion on the plan.
Well, first of all, when you go into a new market, every business expects to lose some money at the start. That's the first point. The second point is that the business became a lot more uncertain because of Republicans, in particular Marco Rubio, eliminating some of the risk corridors and the protections for the insurance companies when they went into the new market. Those risk corridors, those protections, are exactly the ones that George Bush put in under Part D, the drug benefit. If we just had those, are you
blaming the Republicans for the Affordable Care Act now, Zeke?
Not for the Affordable Care Act, but for taking away some of the protections that made it work better. Yes, it is the Republicans' fault for taking away those risk corridors.
That sounds very creative to me. That sounds very creative to me. A new study
No, it's just a fact.
It's not a fact. Look, we're speaking to businesses all the time. They're blaming the Affordable Care Act on the fact that they can't hire employees. They can't afford it. They're going bankrupt. You've seen all the major insurance companies say, I'm not going to be in the program anymore.
First of all, that's not true. It's not all the major insurance companies.
Well,
and second of all,
United Health and Humana. Okay.
Second of all, it also is easy to blame Obamacare for business decisions they want to make. That is a very easy thing to do because Obamacare, as you know, is not popular despite the fact that it's done so much good for the country. It's been bad PR, but not bad on the substance. And it's easy for insurance companies to blame someone else than for their own business decisions.
So a new study finds the Affordable Care Act exchanges will only offer one coverage option to 31% of United States counties next year. Another 31% may only have two options. What are the costs related to offsetting the lack of coverage with Obama's public option?
I'm not sure I understand the question, but Maria, when you talk about it in terms of counties, if you include rural counties, that actually is a much smaller number in terms of population. Most of the American public will have, 80% of the public will have choices, and we do need to give people choices. That's very important. The president's been committed to that. That's one of the reasons to consider the public option if you don't have enough insurance companies in those markets.
Yeah, well, look, and I've got a lot of people writing on Twitter as you're talking. Wayne Perry, he is wrong. Almost every business in America has a double-digit increase. Why are we even talking about this? It is obvious. Unbelievable. Costs have only gone up. The business decisions were a known quantity. Let me ask you this. We know that if Donald Trump wins the election, he's going to repeal and replace. We know that Hillary Clinton is probably going to make changes as well. Even though she's talking about building on Obamacare, we just heard what her husband said. What's the most important change that needs to be made to the Affordable Care Act?
Well, we need to change in three areas. On the Medicaid side, we need all the states to expand Medicaid to get all those people in. States that have expanded Medicaid, their hospitals are doing better, their budgets are doing better, so we need the states to do that. On the exchanges, there are 3 or 4 major changes. We need to have the risk corridors brought back for the insurance companies. We need to enforce the penalties and modify the way that people come into the system. We need to increase the subsidies for people between 250% and 400% of the poverty line.
You know,
and then on a cost control issue, we need to move away from fee-for-service much faster and help the healthcare system deliver care more efficiently. All 3 of those areas are things that we know what to do. There's widespread agreement on what to do, and we just need to implement them.
Our final question here, Dr. Emanuel. Look, when I think back to the president's first 2 years in office, he had both houses, both chambers. He could have done anything. What does he do? He pushes Obamacare down everybody's throats, even though there was a clear feeling that half of America did not want their health care changes. But he pushes Obamacare because he's got the room to do it. He's got both chambers. What a mistake to focus on health care as opposed to economic growth. Here we are 8 years later, and where are we? 1.4% economic growth, and most people blame the cost of health care.
Well, that's a false claim. 1.4% economic growth because we've come out of this financial recession brought to us by
We're
banks.
10 years after the financial crisis now.
First of all, we're not 10 years. We're 8 years after the financial crisis. And every economic analysis shows you that after a financial crisis of the one we had caused by banks and lending, it's a very slow growth. And it is not health care because health care costs have come way down compared to George Bush. That's just a fact.
Oh, I guess it's all rainbows and puppy dogs then. Sounds like it's all rainbows and puppy dogs for the Affordable Care Act then.
The Affordable Care Act has been a big improvement. It's not perfect, but that doesn't mean it hasn't been a big improvement. And you have a strong sense of amnesia forgetting how bad health care was before the Affordable Care Act, with 50 million people uninsured, people who had cancer or heart disease not able to get insurance, and the inflation rate at double digits. The inflation rate is much lower now than it's been before. You're just forgetting the facts and trying to forget how bad it was under George Bush.
Well, we've got the facts right in front of us in terms of the Affordable Care Act, Dr. Emanuel. I don't think there's any question that there's a huge disappointment across the country of this program. I appreciate you coming on and making the case. Thank you so much, sir. We will see you soon.
Thank you.